name is Abby Zachariah. Welcome to Cherished Hand. We are very, very excited to have you. This is our orientation program. I'm going to be talking and telling you about different things, how the agency works, and what you need to know to be successful in your work. We are very happy to have you. This is your part of your orientation. You're going to be learning about different things. Again, my name is Abby Zachariah. I'm the founder of Cherished Hands Home Health. We provide in-home care services to seniors and pediatrics in Montgomery County, PG County, Baltimore County, and Baltimore City, and also Howard County. So this is our orientation program to tell you about different things you need to know to be successful in your work. So this will be after part of your orientation will be to watch this video, and after the video, we will show you video about how you lift and other skills that you need to watch. Then it will be followed by a skilled session where you can actually do those skills that you watch. But before we get to that, I want to tell you about different things and how things work around here. So this card that I have with me, you're gonna get one of these today before you leave. I call it the agency binder because it does have the information on how and what you need to do for at the beginning of your shift. So you have the pre-shift. These are the things that you need to do at the beginning of your shift. And also the post-shift is what you need to do before you leave the client. And the goal of this card is to make sure that we are providing consistent quality care and also to make sure you are successful. In addition to that, it has the agency information, the number for the office number, and the main number. And so I'll tell you, starting by telling you about the agency mission and why we started the agency. Cherished Hands became existence in 2016. The agency was started by my humble self. And I'll tell you a little bit about myself and what drive me to start Cherished Hands. I'm a caregiver myself. I started as a caregiver about 15 years ago. I work in different places, home care, nursing homes, and I went back to school. I got my master's. I'm a nurse, and also I'm a nurse practitioner. But I do know how to deliver care, so I can relate to you, and so I know how you're feeling when the clients. Sometimes we have difficult clients that are challenging, so I can relate to what you're going through. So the reason why we started the agency, the mission is to make sure that we're delivering quality care to seniors, and also to make sure that the caregiver get paid for the work that they do. Because like I said, I've worked for caregiver as a caregiver myself. So, and the vision of the agency is to make sure the agency even overlive myself. So we put in a lot of system in place, and part of it is what we're doing today to make sure you get proper orientation to do your work. And we provide different type of care. One of them is home care, which is what a caregiver will do. A nursing assistant will deliver the care, which include like personal care, bathing, dressing, medication reminders. We also provide medication management. We provide skilled nursing, and Cherished Hands also provide staffing services. So this orientation is brought for anyone working for Cherished Hands. So I might reference things in different way, just relate to which one is applicable to your line of work. Our agency we are licensed by Maryland Office of Healthcare Quality, which means that we have policy and procedures that guide what we do. So part of the policy is what we're doing today is the orientation. So when we hire anybody, we're going to make sure we train them and make sure they know what to do and they're doing the right thing to help them to be successful. So our agency is very diverse. It starts with people of color, Caucasian, Hispanic, and we kind of take that to our advantage because we want to be able to serve any population who needs our help. So we are really big on making sure that we're delivering quality care. I've mentioned this a couple of times, and you're gonna hear me say this again. And so ethical behavior, we want to make sure that when the clients share any information with you, you only use it that for their care. You're not sharing their information with anyone. And also, I'm going to talk about conflict of interest. So when you work for Cherished Hands, sometimes the family member or the clients, they will like you and they will say, oh, can you leave your agency and come work with us? You cannot do that. You cannot work with any of our clients 2 years after you separate from the agency. So I want to make sure that is clear. If they reach out to you, tell them that you cannot do that, and if they need more assistance, to reach out to the agency. We have to make sure we are staying in compliance. So part of it is when you go see a client, please make sure you do your documentation in a letter, and if you need any support, just feel free to reach out to the office. We will be there to support you. And so I want to talk about different policies, and one of them is the gift policy. So you are not allowed to take anything from the client without talking to the office. And the reason being that there's something called an advance directives. It's like a living will, something that where clients sometimes have a power of attorney, somebody else who make a decision for them. So if they want to give you something, we need to let their power of attorney know that mom wants to give flour or whatever it is to the caregiver, so that when they give it to you, you don't come back next day and they're looking for it and you say, oh, you gave it to me, and they say, no, you stole it. But if their daughter or whoever is their power of attorney knows that they're giving you a gift and the office is aware, then it won't be as if you steal from the client. So please do not take anything from the clients without talking to the office. And there's also something called home safety. Before you go into any home, either myself or one of our nurses, they first go in the home and making sure the home is safe for you to walk into. And when you go into any home, when you see an unsafe situation, please excuse yourself and call the agency. However, do not leave your clients unattended, because it will be considered negligence. So one thing I also want to mention that is very important is sometimes, I haven't seen this happen, but based on what is going on around in the country, if somebody have a gun, we want to make sure they put the gun away while we are there. I don't care how much they love you, but just if you see that they have a gun, again, call the agency, because they need to put it away unlocked while we are there. It's for your safety. We don't want to get too comfortable and something happen and it's something bad. Hopefully nothing bad happen. And also an emergency situation that could happen. I want to make sure that you are prepared and know what to do when you have an emergency. There could be a couple of emergencies that happen in the home. One of them could be maybe the client stop breathing. You might walk in now and you see somebody, maybe they're sitting on the chair like this. They're sitting on the chair and you're going like this, and you say, Miss Jones, and they're not responding to you. What should you do? So what I want you to do first is you call 911. The agency has a binder. When you get in the home, the first thing you need to ask is, where is the agency binder? And inside the agency binder, the first page has the client's information, name, date of birth, and also the address, because in an emergency situation, you may not even remember where you are. So, but just make reference the binder and call 911, and you start doing CPR. The 911 will walk you through everything else you need to do, but you call 911, leave the door open, and start doing CPR. If somebody is sitting on the chair, and I assume everyone watching this video, you've already done a CPR class, and if not, the agency will make sure that you are trained to be able to deliver CPR if there's need, if they need be. But if somebody is in the chair sitting up and they're not breathing, you call 911, you leave the door open. You could try to see if you can drag them to the floor and you start performing high quality CPR. The other emergency that could happen in the home is falls. If somebody fall, we call 911. Do not pick them up. Again, if somebody falls, it's not your job to pick them up. Call 911, and 911 will come, and also you call the agency, because the agency have to know. Sometimes they don't have to go to the hospital, but the agency have to know, so we could send a nurse, who could go in and assess the client and see if anything needs to be done. The other emergency that could happen in the home is if somebody's choking. So if you see somebody, maybe they eating, they eating their food or something happened and they start coughing, if you ask them, "Are you okay? Are you okay?" and they say, "Yeah, I'm okay. I'm choking." They're not choking, because if somebody's choking, they cannot talk. So if somebody is choking first, also like I said, you follow your emergency response system, calling 911. So, the other emergency that could happen in the home if somebody's choking. So if somebody's eating and they said, and you see them coughing, how do you know they're choking? They're coughing and they're coughing, and you ask them, "Miss Jones, are you okay?" And they said, "I'm choking." They're not really choking. If somebody is really choking, they cannot talk. That is how we know that they are choking. And what do? You call 911, you leave the door open, and you get behind the client and you make a fist and you put it on the belly button and you start making upward motion like this. And most of the time what will happen is whatever is blocking their airway will come out. But even if it doesn't come out, sometimes they could lose consciousness where they stop breathing. Then you start doing CPR. But also when you're doing this, you got the first thing when there's an emergency is to call 911, because you are just one person in the home and there's limits to what you can do. So that I want to make sure that that aspect is clear. If somebody has an emergency, you need to call 911. The other thing I want to talk about is proper body mechanics. When you go in the home and you're helping clients, we want to make sure that you're using proper body mechanics when you're transferring somebody. And how do you do that? Is by bending on your knees. When we bend on our knees, the knees has a stronger muscle that could support yourself while you're transferring somebody. And if you go like this, you bending your back, and the muscle in the back is not that strong, so you could get hurt. Because there's something called OSHA. OSHA is the law that protects the employees, especially people in the field, to make sure that the employer is providing you a safe environment to perform your job duty. So making sure when you're transferring someone, you're using proper body mechanics, because we want to make sure you're safe. And if something happened, if there's an incident, maybe hopefully you don't hurt your back, or you get hurt at work, the same day you have to call the office. You have to come to the office so we could do the necessary paperwork to make sure you've been taken care of. But I want to make sure that you know how to transfer a patient successfully or do any kind of work so you don't get yourself hurt. And also, if the clients let's say you go in the home and you see the client yesterday, or you were there the other day, and when you see them today, you see that they look different. So we want you to report to the nurse. Call the office. Like I saw Miss Jones yesterday. They just look different today. You don't have to know what is wrong with them, but your responsibility is to identify that they look different, and you let the office know. Then we will call the client. We'll call the client, and also maybe send the nurse to go check on them to make sure they're doing well. So we also on documentation. So we use Alora Plus is the app that we use for documentation. We're moving away from paper. So before you leave today, you get access to that system. You can download the app on your phone, and we'll give you access today to make sure you can log in. And when you log into Alora, on the right hand side, on the top, there's a little button, it's orange button, is a help video. Click on that video, and also there's a little video that the agency make that we can send to you, who could reinforce to you on how to use the app. But one thing I want to say is the app doesn't always work. So if you go in and for whatever reason you cannot log in, go through Google. You can go to Google the way you can get to your bank without using the app. So go search in Google, search for Alora Plus, and you can log in with your credential, and it should be okay that way. That helps sometimes. scrubs, top and bottom. We do have agency polo, and we have shirts that we can share with share with you that you can use. And also making sure that your badge is, you wear your badge all the time, is part of your uniform, and you show up neat and clean to the client, because we have to stay professional. I want to talk about hand washing. So the one-on-one of Cherished Hands is hand washing. We want to make sure when you first get to the client home is you wash your hands. And I talk about HIPAA is a law that protects the patient information. When they share any information with you, don't share with anyone. And our policy on COVID, and this video is made during COVID time, is if you go into somebody's home, we always wearing a mask when we are 6 feet closer to the clients. We want to make sure. And also in your Allura, you check your temperature and put it in and do your screening in Allura. So after you put your temperature in Allura and you do your COVID weekly daily screening in Allura, so we also screen for communicable disease, because we want to make sure that when the people that we are sending to our clients, they are free of infection. So we screen for tuberculosis. It is the state requirement to screen for tuberculosis. So it's either you have a chest x-ray done or you have a PPD done. We will need either of those, a chest x-ray within 5 years or PPD within a year. And also during the flu vaccine season, we want to encourage you to get flu vaccine. We also want to encourage you to get COVID vaccine, because it's going to be necessary. So we do training, which is specific to your job. And one of that is what we're doing right now. So if you're going to be doing any new task that you're not comfortable, please let the agency know, because we do have a simulation room and we can train you in the office before you even go in the home to meet with the client. We will support you to make sure you are set up to be successful to do your job. So the clients, most of the clients, they are the one paying for service. So they hold us responsible to make sure we're doing what we say we're going to do. So please, when you go in the home, don't be on your phone. We do have a policy. You can answer your call if there's an emergency. You can excuse yourself, but don't be on the phone all day long and from one call to the other. It just is very rude, and the agency does have zero tolerance for that. Them is for prevention. Also, we specialize in heart failure management and also dementia. So we're really big on dementia. If you would like to, we would train you. We have an 8 hours of training that you can do after you start working, to make sure that you understand how to manage somebody who has dementia. And there's even advanced training that if you're interested to become a dementia specialist, let us know. We have a training that we can let you go through that will give you the certification. And also, before you leave today, you're going to get your badge. Make sure you get your badge before you leave. And a couple of just housekeeping stuff. And when you go to the client, please make sure you represent. You got to show up, be in the moment with the client. Because we had a client before where the client called the daughter, like, I'm the only person here. Why? Because the caregiver is in the next room making calls, doing their own thing. We cannot abandon our clients. So like I mentioned before, the agency has a binder. So when you first get to the client, I said you should look for the agency binder. This is what it looks like. So make sure you have it. And the first page, you have the client's information, the address, and their date of birth, just in case you need to call 911 if there's an emergency. And also, before you leave today, make sure you sign this form. Just put your initials and fill your name at the bottom. This is to say that you complete your in-person orientation. One of the things I also want to talk about is the call-out policy. Please, we do have 4 hours call-out policy, so if you know you will, and also if you know you won't be able to make it, like you have something planned, let us know ahead of time so we could find somebody else to cover your shift. As you know, this is a huge responsibility when we say we're going to take care of someone, please. So 4 hours call out policy. Don't call out 30 minutes before your shift. We understand emergency do happen, but please try as much as possible to make it to your shift. After 90 days, we're going to do your evaluation, see where you are. And if everything is going well, we'll give you a little raise to appreciate you and for the work that you're doing as well. We do have an hierarchy structure that if you, after you come in now, you are a care provider, the next in a hierarchy structure is to become a team lead. You could do this within 90 days. And when you do your 90 days evaluation, it comes with more responsibility and it comes with a little bit of raise. And also we have care managers who can oversee client care. These are also caregivers, they are care providers. So we do have opportunity for growth within the agency, and we're looking forward to working with you and making sure you're successful. And I want to thank you for choosing Cherished as your place of work where you want to be here. We are very, very happy to have you.